In this tutorial, you'll learn how to properly load the polymer ligating clips into different types of clip appliers and learn how to position them on the structure. This instruction applies both to Grena Click-A-V and the Click-A-V Plus polymer ligating clips. First, choose the appropriate size of the clip. The cartridges are color-coded and the size corresponds to a certain thickness span of the ligated structure. It is crucial to have the appropriate applier matching the color code of the cartridge. Remove the cartridge from the sterile packaging and place it on sterile surface. Each cartridge contains a self-adhesive base which makes it possible for it to be attached in a comfortable position for the operator. The same rules for proper loading apply regardless of where the cartridge is positioned. Each cartridge has the triangular marker that indicates the orientation of the clip after loading to the applier. When attempting loading the clip, make sure that you can see the triangular marker so it faces the person that attempts to load the clip. This plays an important role for the later position of the lock during the application. Grip the applier properly for easy and stable loading. Here you can see how to hold different types of appliers in order to ensure correct loading. Open surgery applier. Angled open surgery applier. Gonzalez-Rivas endoscopic applier. 20 degrees angled endoscopic applier. XXL size endoscopic applier. Hero endoscopic applier. Omnifinger clip applier. When loading the clip into Omnifinger clip applier, make sure the articulating tip is in a straight position. It is also acceptable to hold the endoscopic appliers by the shaft. Do not load the clips by holding the cartridge in your hand or by holding the applier by the handle. Make sure that the triangular marker is facing the person who loads the clip. If the operator who applies the clip is right-handed, load the clip from the right side of the cartridge as shown on the screen. If the operator is left-handed, approach the cartridge from the left side. This affects the visibility of the lock later on during the application. Align the jaws vertically and laterally over a clip and advance the jaws into the slot of the clip cartridge, making sure they are perpendicular to the surface of the cartridge. Advance the jaws until you hear an audible click. In the next step, please remove the clip from the cartridge by withdrawing the clip applier. Make sure the clip is fixed securely in the jaws. The clip bosses should sit in the notches of the applier. You may notice that with the polymer clips the operator can make slight movements on the front handle without losing the clip. Use the rotating knob to adjust the position of the lock properly. The lock should be positioned on the lower branch of the applier, assuming that the endoscopic camera is facing downwards. To apply the clip, position the structure in between the jaws and press the handle to close the clip. The lock should be clearly visible and the user should be able to visually confirm the ligation. Do not clean the structure using the clips. It should be prepared prior to application in order to keep the locking mechanism of the clip to be clear of tissue. When necessary, Click-A-V and the Click-A-V Plus clips can be safely removed using the appropriate size of Grena clip remover. It is important to approach the clip from the hinge side as shown on the screen. Press the handle but do not use the excessive force to unlock the clip. You must remember that removed clips cannot be reused even if there is no visible damage to the clip. Do not approach the clip from the lock side. Grena. Think medical.